Senator Ron Johnson is on the line, we believe. Scott?
Ron, can you hear me?
Well, Doctor, I sure can. Can you hear me?
I can hear you. Senator Johnson, this is a thrill. Thank you so much for joining us.
Well, first of all, thank you for being a doctor. And thank you for being one of the small percentage of doctors who have actually been willing to practice medicine and save patients during COVID. It's unfortunately not all of our medical establishment. I really appreciate all your hard work and efforts here.
Well, Senator Johnson, you have been a hero, and yet you've been a trailblazer. You've been willing to use the U.S. Senate as a place for the exchange of information. It seems like nobody else would allow that to happen. You've facilitated hearings. You've had people like Dr. Peter McCullough. How did that happen? How did you become so much an emerging force in health freedom for America?
It really started back in 1983 when our first child was born with transposition of the great arteries in Minnesota. Well, actually in Wisconsin, but we actually had the corrective surgery. Dr. John Folker at the University of Minnesota Hospital there rebaffled the upper chamber of a heart. And doctor, that's when the term, the practice of medicine really hit home to me, because they didn't just change the pulmonary artery and aorta. What they did is they rebaffled the upper chamber of the heart because the artery switch surgery was too high mortality rate. Now, of course, they just switch the arteries and the kids do fine. My daughter, by the way, is 38 years old. So, I have revered doctors ever since. They saved my daughter's life. And during the pandemic, I was just so disturbed that doctors were being prevented from using their full off-label prescription rights, that early treatment using the widely available generic drugs that work. There's a cornucopia, you know this. You have to treat the disease at its different stages using different drugs. Doctors have to be free to practice medicine, particularly in the midst of pandemic, and we didn't allow it. The big tech social giants, they sabotaged early treatment, and I believe, as many of these doctors that are involved in these groups, hundreds of thousands of people died because doctors weren't allowed to practice medicine. So it so disappointed me. I couldn't sit on the sidelines and watching our completely failed response to COVID, how much freedom it took away from us. Remember, I'm the champion of right to try legislation, which, by the way, is being used today using a drug called Aviptadil, very end-stage COVID. People's lives are being saved using right to try. So again, I'm for doctors to be being at the top of the treatment pyramid. Right now, for a host of reasons, over time, doctors are being crushed at the bottom of the treatment pyramid, and they're being lorded over by the Faucis of the world, bureaucrats that do not have the courage and compassion to treat patients. They're the ones making all the medical decisions, and that's just wrong. And people have paid with their lives because of this.
Well, Senator Johnson, you may not realize how many physicians your courage has empowered to keep pressing on. Without question, a lot of physicians are gun shy. A lot of physicians are not self-employed. They work for big institutions, big organizations, and they know that if they speak a contrarian message, if they do something that's too out there, they may well be putting their job and their profession in harm's way. Having said that, I always tell patients about this drug called Flomax, which is, it was originally indicated by the FDA to shrink a man's prostate so that they wouldn't necessarily pee all day long or necessarily at night. But it's a very good drug off-label to help both men and women potentially pass a kidney stone spontaneously. It's unbelievable to me that physicians typically prescribe off-label 30 to 40% of their scripts. We've somehow become bad people that can't be trusted. We can't have the conversation with our patients to decide together, what do we want to do? How do we want to proceed? And your courage has really continued the spirit of so many physicians. I want to close with one question, Senator Johnson. As you look forward, and thank you for running again, thank you. But as you look forward, what are some of the big concerns that you have regarding health freedom for Americans?
Well, again, when you take a look at what I call the Covid Cartel, the current administration, the healthcare agencies that have been totally captured by Big Pharma. And I've always been supportive of Big Pharma. You need to make a profit in order to have the research dollars to develop new life-saving drugs. I want life-saving new drugs, but they have been corrupted, and they have corrupted the agencies. Then you throw on top big media and the big tech, big media's social giants. That is the COVID cartel, and they not only sabotaged early treatment, but they also censored it as well. And so we've got to break up that cartel. That is, from my standpoint, the number one thing we have to do is we've got to put physicians back at the top of the pyramid of treatment. Physicians have the overall responsibility of the patient, not to faceless bureaucrats in the NIH or the CDC, their FDA. It's got to be doctors, and they had to be free to practice medicine. And again, I understand what's happening with the grant money flowing from the Fauci's of the world, our health agencies into, for example, university research centers and hospital associations, and we don't have as many doctors practicing independently. And I understand their legitimate fear because so many people have lost or certainly have had their license threatened. We've got to correct that. Doctors have to have the primary responsibility, but they have to be allowed to use all their tools, including off-label prescription rights.
Well, Senator Johnson, thank you so much for joining us. And I'm just going to say this. The words of Esther 4:14 were the words that drove my wife and I to make the decision to run for governor. And those words are, have you considered you're in the position you're in for such a time as this? And I do thank God that you are in the position you're in and that you've responded to it. And you know that your life, your job as U.S. Senator is for such a time as this. Thank you so darn much.
Thank you for what you've done. Support Dr. Johnson.
Thank you.